What are the coronavirus symptoms? Coronavirus infects the lungs. The symptoms start with a fever followed by a dry cough, which may cause breathing problems. This is a replacement, continuous cough and means coughing tons for quite an hour, or having 3 or more coughing episodes in 24 hours. If you always have a cough, it's going to be worse than usual. It takes 5 days on the average to start out showing the symptoms, scientists have said, but some people will get symptoms much later than this. Actually, the Planet Health Organization, WHO, says the time period lasts up to 14 days. People are going to be most infectious once they have symptoms, but there are suggestions some can spread the virus even before they're sick. The early symptoms can easily be confused with other winter bugs including colds and flu. How deadly is coronavirus? The proportion dying from the disease appears low, between 1% and 2%, but the figures are unreliable. Thousands are being treated but may continue to die, therefore the death rate might be higher. But it's going to even be lower if many mild cases are unreported. A World Health Organization examination of knowledge from 56,000 patients suggests 6% become critically ill, lung failure, septic shock, organ failure and risk of death. 14% develop severe symptoms, difficulty breathing and shortness of breath. 80% develop mild symptoms, fever and cough, and a few may have pneumonia. About coronaviruses. Coronaviruses are an outsized family of viruses. Some cause illness in people et al. Cause illness in animals. Human coronaviruses are common and are typically related to mild illnesses, almost like the cold. COVID-19 may be a new disease that has not been previously identified in humans. Rarely, animal coronaviruses can infect people, and more rarely, these can then spread from person to person through close contact. There are 2 other specific coronaviruses that have spread from animals to humans and which have caused severe illness in humans. These are as of now, there's not a selected treatment for the virus. People that become sick from COVID-19 should be treated with supportive measures, people who relieve symptoms. For severe cases, there could also be additional options for treatment, including research drugs and therapeutics. The COVID-19 virus may be a member of the coronavirus family that made the jump from animals to humans late last year. Many of these initially infected either worked or frequently shopped within the Huanan seafood wholesale market within the center of the Chinese city of Wuhan. Unusually for an epidemic that has made the jump from one species to a different, it appears to transmit effectively in humans. Current estimates show that without strong containment measures, the typical one that catches COVID-19 will pass it into 2 others. The virus also appears to possess a better death rate than common illnesses like seasonal flu. The mixture of coronavirus's ability to spread and cause serious illness has prompted many countries, including the United Kingdom, to introduce or plan extensive public health measures aimed toward containing and limiting the impact of the epidemic. Coronaviruses are a family of viruses that cause disease in animals. 7, including the new virus, have made the jump to humans, but most just cause cold-like symptoms. 2 other coronaviruses, Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS), are far more severe, having killed quite 1,500 people between them since 2002. The new virus, officially called COVID-19, is additionally dangerous. Thus far, around 20% of confirmed cases are classed as severe or critical. So far, around 15 to 20% of hospital cases are classed as severe, and therefore the current death rate varies between 0.7% and 3.4%, counting on the situation and, crucially, access to good hospitalization. What is a coronavirus? A coronavirus may be a virus that's found in animals and, rarely, or often transmitted from animals to humans then spread person to person. Additionally to COVID-19, other human coronaviruses have included the MERS virus, or Middle East Respiratory Syndrome. The SARS virus, or Severe Acute Respiratory Syndrome, which first occurred within the Guangdong in southern China. Coronaviruses are common in several animals. Rarely, an animal coronavirus can infect humans. There are many various sorts of coronaviruses. A number of them can cause colds or other mild respiratory, nose, throat, lung illnesses. Other coronaviruses can cause more serious diseases, including Severe Acute Respiratory Syndrome (SARS) and Middle East Respiratory Syndrome (MERS). Coronaviruses are named for his or her appearance. Under the microscope, the viruses appear as if they're covered with pointed structures that surround them, sort of a corona, or crown. Like cold and flu bugs, the virus is spread via droplets when an individual coughs or sneezes. The droplets land on surfaces and are picked abreast of the hands of others and spread further. People catch the virus once they touch their infected hands to their mouth, nose or eyes. It follows that the only most vital thing you'll do to guard yourself is keep your hands clean by washing them frequently with soap and water or a hand sanitizing gel. For more information on the way to protect yourself, attend our guides on symptoms and coverings. What are the symptoms of a coronavirus? COVID-19 symptoms range from mild to severe. It takes 2 to 14 days after exposure for symptoms to develop. Symptoms may include fever. The Centers for Disease Control considers an individual to possess a fever when he or she features a measured temperature of a minimum of 100.4 degrees Fahrenheit 38 degrees Celsius. Cough, shortness of breath. Those with weakened immune systems may develop more serious symptoms, like pneumonia or bronchitis. You'll never develop symptoms after being exposed to COVID-19. So far, most confirmed cases are in adults, but some children are infected. There's no evidence that children are at greater risk for getting the virus. What causes a coronavirus infection? Humans first get a coronavirus from contact with animals. Then, it can spread from human to human. Health officials don't know what animal caused COVID-19. The COVID-19 virus are often spread through contact with certain bodily fluids, like droplets during a cough. It'd even be caused by touching something an infected person has touched, then touching your hand to your mouth, nose, or eyes. How may be a coronavirus diagnosed? If you think you've got COVID-19, you ought to contact your general practitioner immediately. Before getting to the doctor's office, call together with your concerns. This may allow the office to gather information and provide you with guidance on next steps. To diagnose you, your doctor may run tests to rule out other common infections. In some cases, your doctor may suggest you self-isolate to stop the spread of infection. Coronavirus treatment. There is currently no vaccine or treatment for COVID-19. Symptoms of a coronavirus usually get away on their own. If symptoms feel worse than a standard cold, contact your doctor. He or she may prescribe pain or fever medication. As with a chilly or the flu, drink fluids and obtain many rest. If you're having trouble breathing, seek immediate medical aid. When possible, avoid contact with others once you are sick. If you've got COVID-19, wear a face mask to stop spreading the virus to others. The CDC doesn't recommend wearing a mask if you do not have COVID-19. If you become ill, if you're showing symptoms of COVID-19, reduce your contact with others. Isolate yourself reception for 14 days to avoid spreading it to others. If you reside with others, stay during a separate room or keep a 2-meter distance. Visit a healthcare professional or call your local public health authority. Call ahead to inform them your symptoms and follow their instructions if you become sick while traveling back to Canada. Inform the steward or a Canadian Border Services officer. Advise a Canada Border Services agent on arrival in Canada if you think you were exposed to someone who was sick with COVID-19, albeit you do not have symptoms. This is required under the Quarantine Act. The Canada Border Services agent will provide instructions for you to follow.
I hope you are enjoyed watching this video about health issues. Comments, likes and share. Subscribe to our channel and learn more about new things. If you have any problem related to health, then you will contact Health Issue page.